Hi everyone. In today's clip, I will talk a little bit about cold sores. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. So, cold sores are far more than just simple blisters. They are the visible expression of a lifelong sort of relationship between your immune system and a virus that spends most of its time or most of its life hidden inside your nervous system. Now, so to understand how to prevent and treat cold sores, it helps to basically understand what is actually happening underneath your skin. So a cold sore, which is also called fever blister, is caused primarily by herpes simplex. This is a virus. It's called herpes simplex virus type 1 or HSV1. And also sometimes, although HSV2 can occasionally cause this kind of oral sores as well. Now, once infected, the virus enters through tiny breaks in the skin or mouth. Then it multiplies in skin cells and travels along the sensory nerves, where it's going to be hiding inside the nerve cluster called the trigeminal ganglion. Now, in there, it's going to remain dormant, sometimes for decades even. And when it is triggered, it travels back down the nerve and creates another outbreak. So unlike bacteria, herpes viruses are never completely removed by the immune system. The goal is to keep them dormant then as long as possible. The stages of cold sores the stages that it goes through are stage 1, which is tingling, and this usually lasts between 6 to 48 hours, where there's tingling, itching, burning, tightness, and even mild pain. This is the best time basically to begin your treatment if you need to. The stage 2 is when the skin becomes inflamed and it's red, blood flow increases, and immune cells start to arrive at the location. Then there is stage 3, which blisters, and this is when the small clear blisters form, and inside them there are fluids, and in there's millions of virus particles. This is the most contagious stage at this point. Then we have stage 4, which is ulcer, when the blister breaks and the area becomes painful and the body begins removing the damaged tissue. Then we have stage 5, which is crusting or crust, where a yellow-brown so the crust forms and the new skin is growing underneath. Then we have the stage 6, which is healing, when the scab falls off and the healthy skin returns and this is this is usually doesn't leave any type of scars or anything behind. So the cold sores keep returning because the virus waits until your body's defenses are weakened or they're low. And the common triggers for that include physical and emotional stress, because stress hormones suppress parts of the immune system, lack of sleep, surgery, some sort of illness, fever, overtraining, which gives HSV an opportunity to sort of reactivate. Many people develop cold sores after skiing, beach vacations, cosmetic procedures, dental work, cancer treatments, steroids, or hormonal changes, like, for example, menstruation, pregnancy, menopause, or any type of nutritional deficiencies. There's actually evidence that the outbreaks are frequent when there are deficiencies of zinc, vitamin C, vitamin D, B12, folate, or some sort of an injury, basically. So in modern medicine, antivirals are prescribed, and these include medicines such as acticlovir or valacliclovir or famacliclovir, but they do not eliminate HSV from the body. They can only shorten the outbreak and they can reduce the pain a little bit and lower the frequency of recurrences when used appropriately under medical guidance. Topical antiviral creams are generally less effective than the oral treatments. On the orthomolecular side of medicine, we focus on optimizing nutrients that support immune function and can reduce viral activity. Nutrients, for example, such as lysine, this is the best known orthomolecular approach. HSV needs arginine to reproduce. Lysine competes with arginine, and so lysine supplementation can reduce recurrence frequency. Other than supplementation, lysine is also found in fish, chicken, yogurt, kefir, cheese, and eggs. Also, reducing arginine during an outbreak is very helpful. Foods that are highest in arginine include things like chocolate, peanuts, almonds, walnuts, cashews, sesame, and pumpkin seeds. These foods are nutritious overall, but some people find temporarily reducing them during an active outbreak sort of helps quite a bit. Next, we have vitamin C. This nutrient is quite versatile, and I really cannot say enough about it. It supports white blood cells, it does collagen repair, it does wound healing, and it has antioxidant defenses. This needs to be in mega doses, though, during the flare-ups, but if it is done in high doses regularly, it keeps things sort of under control. Then we have zinc, which is one of the most studied minerals and supports immune function, skin repair, and it promotes antiviral activity. Some topical zinc preparations have shown benefits in reducing the healing time. Now, next we have vitamin D, and we know that people with low vitamin D can actually experience poorer immune responses. Maintaining a healthy level of this nutrient supports immune regulation. Then there's B vitamins, and they support healthy nerves, particularly B1, B6, and B12. Next in line, we have selenium, which supports antioxidant enzymes that actually protect immune cells. And last but certainly not least, and extremely important, are probiotics. Now, a healthy gut microbiome influences the immune system. Maintaining gut health then supports resilience against recurrent infections. On the botanical and traditional side of remedies, we have lemon balm, which is one of the strongest herbal options that can reduce sort of viral activity and speed healing and decrease the recurrence. Next, we have licorice root, which contains antiviral compounds, but it should be used with caution because excessive intake of that can raise the blood pressure and lower the potassium levels. We have aloe vera that can soothe the pain and support healing. We have natural honey. Medical grade honey actually has antimicrobial and wound healing properties and can help some sores sort of heal comfortably. In traditional medicine, this is considered an expression of disturbed body fluids and an excess of irritating heat or corrupted material that are seeking an outlet through the skin. The treatment then aims to sort of restore internal balance, which would include cooling foods like and as well as like barley water, pomegranate, chicory, endives, sour cherries, cucumbers, lettuce, rose water, purslane, and liver support, because the liver is absolutely pivotal to the quality of your blood. Also, gentle bowel regulation is quite important because accumulated waste will worsen the inflammatory conditions. So gentle cleanse and regulation with appropriate diet and hydration is absolutely emphasized in there. Also remember that strong emotions will disturb the body fluid balance and contribute to illness. So rose water and rose oil are traditionally sort of valued for their cooling and soothing qualities. Now remember, it's rose oil, not essential, not rose essential oil. They're two different things. Violet preparations are also traditionally used to calm heat and inflammation. Next, we have marshmallow root. Traditionally, this is used for soothing inflamed tissues because of its mucilage sort of content. So to prevent recurrences, basically you need to aim for proper nutrients, 7 to 9 hours of sleep, regular exercise without overtraining, proper and good hydration, as well as proper stress management, and of course avoid picking at the blisters to reduce delayed healing and the spread. On the metaphysical side of this ailment, because the mouth is associated with communication, speaking your truth, receiving nourishment, giving and receiving affection, and boundaries are sort of things that we need to look at. A recurring sore on the lips can be interpreted as suggesting that one of these areas basically need attention. Unspoken words, internal conflicts, self-criticism, anger, excessive worry, and fear are all associated with cold sores. Hope this has been helpful. My clips are available on TikTok, Telegram, and YouTube. Like, share, and follow for more. Be the light.